irritants, they are going to develop the skin changes. So there is no any predisposition in ICD. All the individuals who have come in contact with the irritants are going to develop the skin lesions. Whereas in allergic contact dermatitis, it is very interesting. Why? Because there are certain genetically predisposed individuals who are going to develop the skin inflammatory or eczematous changes only when they come in contact with certain allergens. Not all the allergens are going to produce ACD in these individuals, but yes, there is some genetic predisposition for these individuals to develop ACD. This is first difference, and the mechanism is certainly very simple to remember, because ACD is genetically predisposed individuals are going to be affected. So there is going to be some immunologic phenomenon, whereas in ICD there is no any immunologic response which will be mounted by these patients. So in this, you also should remember that there are 4 types of gel and combs, out of which this is example of type 4 hypersensitivity reaction, and we can also call it a cell mediated immunity or delayed type of hypersensitivity. There is one question for all of you. So type 4 hypersensitivity reaction, this can be identified, this can be confirmed by which diagnostic test? If you know the answer for this, please leave it in the comment section. And distribution of the lesion, so in the ICD, wherever there is a contact with the skin, only over those areas ICD lesions, eczematous changes can be seen. Whereas in the case of allergic contact dermatitis, initially there will be lesions only at the site of the contact, but they can slowly disseminate to involve even the normal skin which did not had any contact with the allergens. Okay, this is one more difference. And in the symptomatology also, you can see that these patients are going to have itching or pruritus in ACD, whereas in the ICD mainly burning and pain will be there. And why burning and pain will be there? Simple. So what are the examples of substances causing ACD, ICD? If you remember that, you can understand why there is burning and pain. So you can see acids and alkali. So if acid of certain concentration falls on anybody's skin, the skin is going to burn. Okay, and there is going to be pain. And also please remember, most important cause for irritant contact dermatitis are detergents. They are so much common that in fact this ICD is sometimes also referred to as housewife's eczema if it is caused due to detergents. If it is caused due to detergents, this is also referred to as housewife's eczema. Okay, but post COVID, I don't think this this name may be apt. Why? Because even many husbands have started, washing the dishes. So maybe we have to change this to husband's eczema. Okay, that was on a lighter note, but yeah, it is still referred to as housewives eczema only in the books. Okay, and coming to the allergic contact dermatitis, there are various allergens. Okay, there are numerous allergens, but definitely for exams, the ones which I have written here are the most important ones. So there are certain metals. In the metals, nickel is very important for you to remember. And in the bindi there is an adhesive which consists of para-tertiary butyl phenol, which can cause ACD. Antibiotics topically, previously we used to use neomycin or neosporin. These also used to produce the ACD. And the last one is the AIIMS question, previous AIIMS question. So potassium dichromate, which is present in the cement, can produce the allergic contact dermatitis in the masons or daily wage laborers who come in contact with the cement. Okay, so these are the important difference between ICD and ACD. I hope all of you have understood all these differences. So now if we look at this question, you will understand that in ICD, which of the following statements are right? So it can occur in anyone without predisposing factors. This statement is right. And due to direct toxic effects of a strong chemical, yes, that is acids or alkalis, they are strong chemicals. So this option is also right. And